Hello, good evening, and welcome to today's webinar. As we are settling in, the session today is about geriatric care, the concept of aging and the care that we ought to be giving. I know we are all in one way or the other affected or involved in the care of those who are aging in our communities, maybe our parents or even grandparents, or some of us could actually be going into that phase that we call aging, old age. So just before we start, I would like to introduce myself as your moderator for today's webinar. I am Rono Timothy. I am a young doctor, so it might be kind of weird. Why am I moderating a session for the aged and aging? But I hope that we are going to get to learn a little bit more on the concept of aging and what are the special considerations we should have for our aging population and those who are getting older. Kindly, as you come in, you could just drop in a sign-in message, just so that we get a feel of who is here. Just say, maybe drop your name and the KMA division or where you're practicing as we look to start as in a few, as we give a little bit more time, maybe 2 or 4 minutes for other members to join in. So you may want to use the chat box, that is, you're welcome. But in the course of the webinar, I'll be asking us to drop our questions in the Q&A segment, then we'll address them. So in 2 minutes, I think I'll be starting us off. Okay, so once more, welcome to this session. And as I had mentioned, it is being run by the Kenya Medical Association Physician Wellbeing in conjunction with the Senior Doctors Network. At this point, I would want to invite Professor Stephen Okeo, who is the convener of the Senior Doctors Network, to just give us a welcome note before I can introduce our moderator, our speaker for today. Professor Okeo.
Thank you, Dr. Rono. Good evening, everyone. I want to appreciate the opportunity and the thought of organizing this intercession. and a very warm welcome to Dr. Nderitu to be with us here. I want to start from the question you posed, Dr. Rono, about what is a young doctor doing in this forum. And the answer is simple. As I said in the previous session, the best time to prepare for old age is yesterday. So indeed, I'm here with my granddaughter Zila. Say hi. Yes, okay. Now stay aside and avoid interfering with the meeting, okay? Now, as we were developing the program for senior doctors, some of the literature a lot of the literature I came across, there are 2 or 3 recurrent themes or terms or concepts that recur when you're talking about old age and psychiatry and psychology. And those are stress, burnout, negative ideation, such as ideation of suicide, etc. And so I hope that in the course of the discussion, this will come to the fore. And just to share an information I got from that literature is that as far as these concepts are concerned, the demographic profile of doctors in practice going from young age to old age are essentially similar, except for one. And that one difference is alcohol. They are different except alcohol. The use of alcohol, including advanced use of alcohol, is similar across the generations. But the other things like burnout and stress seem to get a little bit better in old age, indicating that older doctors seem to develop some resilience if they stay in the profession and practice long enough. And so I hope also that the keynote speaker will also address this. Thank you very much again, and everybody welcome to this illuminating session.
Thank you very much, Prof. And that is encouraging that, as they say, the best time was yesterday, and I guess today is the second best time. So without further delay, I'll go ahead and introduce our speaker for today. So our speaker is Dr. Grace Kariuki Nderitu. Grace Kariuki Nderitu is a marriage and family therapist with a career that spans a few decades and a cross-cultural setting. She has been able to live out her passion that is mostly in family and relationship counseling, both in Kenya and in the USA. She is board certified, and she has also worked with clients across many other parts of this of the world, across many continents. So she holds a bachelor's of arts degree in Christian ministry and master of arts degree in marriage and family therapy. She is board certified, as I said, both in Kenya and was, I think, when she worked in the USA. So today she has a segment that targets both how we should respond to the aging population among us, and also caring for the carers, which is usually mostly neglected bit. So I would like for us to welcome her to take over in the course of her presentation. If you have any questions, please utilize the Q&A segment. We'll address the questions at the end. And again, karibu, Daktari.
Thank you, Dr. Rono. It's a pleasure to be here today, and I am looking forward to being able to add value to your lives as we talk about the psychosocial support that our aging, whether it's parents, personal, as we go through that process that is a natural process of the life cycle. So I am glad to be here, and one of my signature talks is usually on temperament. I tend to see people in terms of how they are wired, how their brain processes information, plus how they have been socialized to think about themselves and the world. So as I share, I will be sharing my slides. You will be able to see that I tend to allow myself to look at individuals from that aspect of how their worldview has formed, because then it talks to us about how we individually are going to be relating to what is going on in our lives. So feel free to use the chat to ask any questions, to make any comments. I love to hear what people are thinking. And I will try my best to try and give the information I have in a timely way, so we can have some time at the end to chat. Now, socially, I am married and I have two boys. Together we have two boys. I am an older mom of young children. My boys were born in my 40s, and one of them is turning 16 next month, and the other one is turning 12. And so I am actually dealing with the alpha generation. And so it's and I'm a Gen Xer. So it is quite an adventure to do that. And so I'm really happy to be here and to share the information I have. So this topic in our talk today, we will try to talk about what are the things that our older generation is going through. And many of us, I'm sure you have your parents. And if you are not the one who is in the aging space, that is the age beyond 60. That's what I'm calling the aging, because that's towards retirement and the loss of what we have always had, this physical strength, psychological strength, and social strength that we have known for years. And myself, I have a parent who is now 86, and she just started this year needing extra care. And so I am in that space. And sometimes we call ourselves, when you are raising children and your parents are needing your psychosocial support, we call you the sandwich generation, because you are taking care of your young children and then taking care of your aging parents. And so I am right in the middle of that. And so it is a topic that is dear to my heart, because this year, my family and myself, we have had to now consider the fact that our mother, who has been very, very active, she raised us for the most part by herself. And we have seen her very active. And now she is the one who needs us to take care of her. It was very difficult for me to one day realize that I need to kind of almost like change her diaper. It wasn't a diaper issue, but it was she had susued on herself, and she needed some help. And it really touched my heart to think that years ago I saw her washing my bed sheets because I had susued on the bed, and having to see her do all of that to support us. And now it was my turn to do the same thing for her. And so it can be quite psychologically touching, and I really kind of am in that space. So the benefits of this, talking about this, it's a topic that needs to be talked, is to reduce loneliness and isolation for the aging population, but also their adult children who are having to take care of them. And sometimes we will talk some more about how that the caregiver loneliness and isolation happens. And then it helps for us to be able to learn and to figure out how to enhance mood and resilience. The older generation, as they become older, they struggle quite a bit with mood disorders like anxiety and depression. And it is good for us to talk about that. How can we help them? Because they have been resilient for years. And how can we help them to continue that resilience in their life cycle where they are, where there is a lot of triggers to mood disorders. And then also mood disorders and resilience for their adult children who are also going through a grief process of losing the parent that they knew. And then it will help us improve adherence to medical care. Now, in our society, we know, me included, that we tend to use medical care for treatment, and we are not very keen to use it for preventive care. And so kind of even for us who are Gen Xers and those who are that other generation before millennials, or the ones who are ahead of me, to be able to also understand that we do need to prioritize medical care that is geared more towards prevention than treatment of disease. And then increase overall quality of life and dignity in aging. And I will tell you that in my own experience, as I watch my mom, I really do feel a lot of apprehension to think that she is going to age but without dignity, and so trying to do as much as we can to be able to support her in that. Now, here I am talking about now the common psychosocial challenges of our aging generation, our parents, and those of us who are also we are moving towards retirement, or we are already in retirement. And the other thing that is happening these days, a lot of people are retiring and then they are going into consultancy. And so we need to kind of look at this and see if those of us who are still working, but we are in that post-retirement space, whether we are experiencing some of these things. So grief and loss in terms of health, in terms of physical strength, mental strength, even psychological strength, not to mention spiritual strength, depending on our life cycle, what we have experienced in the past, but also independence, being able to do your own financial books, being able to wake up and make your own breakfast or take care of your own things, and issues like role changes. And in the independence also is where now we are losing our parents who are aging. They are losing their independence to make decisions, and now they have to rely on other people to do that. So there is an issue of grief and loss. The other day I was dealing with, and I don't know whether I have that here, the fear of death and the loss of loved ones. So somebody who has been married to their sweetheart, regardless of how that relationship was, and then they've been married for 50 years, they've been married for 45 years, and they lose that individual, then there is quite a bit of loss that happens. And working with families, sometimes I do hear the children, the adult children of their parent who lost their spouse. They may not even understand the process of grief, and that what the outcomes they are seeing with their parent has something to do with grief and loss. It's not stubbornness, it is not anger. That is the expression, but really what is going on in the inner experience of that parent is that the grief process. And we know that the grief process is quite a difficult space to be in. And then loneliness, retirement, and, because now I don't go to work every day like I used to, loss of social networks, all those friends and colleagues that I was used to, customers I worked with, people I served. And now in our society, usually retirement means moving back home, moving to the village. And we don't actually realize that when we move to the village after retirement, we are losing quite a bit, and especially the social networks. And therefore now we have to go there and start creating new networks. And then sometimes the village where we are going back to, those individuals, we are not on the same level in terms of cognitive, in terms of exposure, and in terms of many things, not social, but emotional maturity. And we might find that we are not, now our parents going back to the village, they may not be able to be okay because their social networks have, it's hard to provide that. Ageism, that is basically our negative attitudes towards aging adults. And one of the things that we would have to do, especially with our Gen Zs and our alpha generations, is to be able to really help them understand the wisdom that their aging grandparents or other individuals who are in the aging space, that they have a lot of wisdom that they can learn. They may not know social media, they may not know Roblox and other things, but there is a lot of wisdom that they can learn from that. And it's hard for us, I myself, having to, my mother doesn't speak English that well. My mother-in-law, she passed on 2 years ago. She didn't speak Swahili either because she grew up in Nyeri. So what she spoke was just Kikuyu, and my children were not able to converse with her. And I remember my son, then 14, he really one day was very emotional and crying and says, "I don't know why, Mom, I can't communicate with Shosho. I can't talk to her." So there are other kids who would look down on aging adults, and we need to know this. This can also be a problem that the aging can experience. Isolation can also be, and it's something that we know, and sometimes it is psychological in the fact that it's shame that they may feel because of loss of all these things I'm talking about. And so the loss of ability to do things for themselves, the loss of ability to think straight, or to have the freedom and the independence they had before, it can lead people to feel ashamed. And so it is important for us to kind of understand how would we then support an individual like that. And most of the times is not to just look at the behavior, but also try to think in terms of in terms of empathy, what could they be experiencing right now, so that we just don't look at the behavior. We are not able to look at the emotional, what we might call motivation for the behavior. And then financial, this can also be a challenge because of decreased income and fear of death because their friends are dying, plus maybe they have lost a loved one. Elder abuse and neglect, we know this, where we may not have the ability to live with them, but we tend to employ people to take care of them, and then they are not being given the kind of care that they deserve. And the other thing is sometimes adult children of aging adults have their own trauma with their parents. And therefore, you might see that coming out in abuse or neglect, whether it is abuse of verbal nature or psychological nature, not taking them seriously, not paying attention to what they emotionally need. so that there is neglect or dismissal of their needs. And then we have, you know, older adults who use their children as a retirement plan. We know that. Sometimes it's called black tax, sometimes it's called entitlement. And if I may use some Swahili here to what we call guilt tripping, where a mother or a father would say, what's the use of you kids? Niliwalea. Munakumbuka vile nilienda njaa. Munakumbuka I even lost whatever. I took loans. And what is it that I have to show for that? So that feeling that can really cause stress, not only to them, but also to the children. And so those are some of the things that we see and we hear. Now, then we have how family members see their aging parents. So they might see them as dramatic, as angry, as hard to deal with, or resistant. And then we might see them as inflexible and stubborn. That is, they insist on the way they know it. That is what they know. And they don't want to do any kind of flexibility. We might see them as picky and irrational. You know, I stayed with my mom for a few weeks, and she would pick on something. Oh, that tea, that are you sure that milk was fresh? And she has this pickiness and some things that look irrational, and it can be very frustrating for the caregiver. Or they might be seen as childish or inconsiderate. There is what we call filial anxiety, is the stress of having to take care of aging parents, and I'll speak a little bit on that. Then we have depression, the symptoms of depression, or what we might look at and say she is being antisocial. Hapendi watu, ako irritated na watu, and these are some of the things we are seeing as our parents are getting older. And for those of us who are in that space, we might also experience being told that this is the way other people are experiencing us. So I wanted to use the temperaments, and now I am really the kind of therapist who really thinks that our worldview, which is your temperament, how you think, how you feel, and how you act, plays a big role in how we respond or react to life experiences. And so the choleric individual is usually an individual who is driven, very determined, a problem solver, in control. And so what you will see with a choleric adult who is aging, they will have frustration with loss of control because they love to be in control. So the declining mobility, the dependence, or needing help can feel for the choleric adult who is aging humiliating. It can feel like a humiliation. Impatience with caregivers may see support as interference and push back against being managed. You are not going to tell me what to do, even when they are not able to do those things for themselves. So it's good for us to understand this way of an aging adult. If you see these ways of managing, reacting, then you know you are dealing with a choleric adult. Difficulty accepting weakness. They may deny health problems or avoid discussing vulnerability because that to them is weakness, it's a loss of power, and therefore it means they are not valued. They have lost their value. And then critical of others can be demanding or harsh if they feel things aren't being done their way. And as I'm sharing this, it is important for you to begin to think about if you are taking care of an aging individual, whether it is you are offering social support or even medical support, where you keep seeing them arguing with you about what you believe is the best care for them. And being able to understand that there are some underlying issues for them, and that for choleric adults is going to be mainly the loss of control, basically grief and loss. and they are reacting to that because it means something to them. It means that I am weak, I am not able. Helplessness, which is what comes with a loss of control, is very hard for the choleric to be able to handle. Now, those of us who are not aged yet, and so we are in our midlife, or we are younger, whether you are in your 20s or your 30s, 40s, 50s, it is important that you understand yourself, that you understand how you are wired, so that now you can start creating modes of operation within yourself that do not put you in a state when you are older. It will be very difficult for you to shift with how life is shifting, and you live in either denial or fight mode, where you can't just relax and allow life to be. Now, how to support a choleric aging individual is to offer choices, involve them in making decisions about their care, so that you can preserve their feeling of autonomy, that they are still valued, they are still able to make certain choices. Acknowledge their strengths, highlight their wisdom, their leadership and ability to inspire others, because that's what a choleric is. They are leaders. And so as they age, you know that they are going to lose some of that in a way. But then if we can find ways to still give them the opportunity to show leadership, to share their wisdom, and even to inspire us, then we can preserve their feeling of goodness, their feeling of meaning, and their feeling of value. Then set meaningful goals, encourage projects, mentoring, or volunteering that channel their drive. Because as I said, that the choleric is a very driven individual, very strategic problem solver, and visionaries, and they are also very directive. And if you can find ways to be able to encourage those strengths that they are losing because of aging, you can really preserve their feeling of worth and value. Then balance firmness with respect. So my mom is a sanguine choleric, and so she is driven, but she's also absolutely social. So she talks a lot, and sometimes when we are talking about her caregiving, and the first thing she does, if I suggest, Mom, your pressure is not coming down, I think you need to go and see this specialist, and immediately she will shut it down. Now, for me to understand that she is not shutting down the idea, she is shutting out the fact that somebody else is giving her the idea. It's not her who is making the decision. And I have to do it with firmness, but I also have to do it with respect, so that now I can set boundaries, but I am doing it with dignity and allowing her to know that it is for her best interest. So listening to her before I get frustrated and throw my hands up and do whatever I will do. I need to be able to manage myself, manage how I'm experiencing her, so that I can support her in a way that makes sense to her. Now, when we talk about phlegmatics are individuals who are calm, cool, and collected. So they tend not to speak too much. They tend not to be too upfront with how they feel. They don't like vulnerability because they are trying to keep harmony. They are conflict averse. So what you want to do is to understand their challenges. They will tend to withdraw, may become too passive, leading to social isolation and disengagement. So you might see they stop going to their women's group, or they stop socializing too much. They like to stay by themselves, but then you might see that their emotional expression is non-existent. It's like they are frozen, and they are not they are obviously what I'm calling here passive. And the social isolation and disengagement, we want to understand that, so that we can support. Avoidance of conflict might not express needs clearly, even when struggling. So one of the things that we need to do as caregivers of our aging generation is to learn about personalities and how different personalities will express. Because now, if the senior is a phlegmatic, doesn't like to cause any trouble, what they will do, they will act as if they don't need anything. So they are calm, they are cool, but they are not expressing what they need. So sometimes these are the individuals that finally you guys find out that they have been sick, they have not been feeling well, and they are not saying anything. So being keen to understand who your patient or the person you are taking care of, understand their personality and understand how they respond to life, so that you can catch them when they need that extra motivation to do something. Now, the phlegmatic by nature is lazy. So this is where we are talking about low motivation. And so they will be inactive. They don't have a lot of high energy, which can worsen physical and mental health. So where they are not talking, so they are not expressing what they are feeling inside. Why is expression of our inner experience important? Is because it helps us to release the tension that is held in our brain because of now overthinking. The phlegmatic, even though they may look like they are not emotional, they are. They tend to be quite introspective and they live in their head. And what they do, they can have a full conversation with another person in their mind. And then at the end of that conversation, they decide to avoid to express themselves. So we do need to realize that, that we would have to encourage them to do physical and mental work to be able to release, to release what is in their brain, and as well as physical release of tension because of sitting around and having low motivation to do anything. Indecisiveness, they tend to not make decisions because they don't want to harm anybody. They want to keep the peace, and so may lean too heavily on others to make choices for them. I have a child who, if you ask him what he wants, he will always tell you, I don't care. So what does that mean? It means whatever you choose, me, I'm fine with it. And then I have another child who is going to come and say, I would like, so they express themselves. And so getting to know yourself, if you are a senior, or even as an individual, as you continue in your life cycle, it's good to know yourself. Encourage gentle activity for the phlegmatic seniors, walking groups, light hobbies, or faith-based gatherings to keep them engaged. Draw them out, ask open-ended questions, and create safe spaces for them to share feelings or needs, and try not to pacify or to give unsolicited advice. Ask questions like, how do you feel about that? Tell me more about what you are thinking. That sounds like a really good idea. How do you think we can support you in making it a reality? Then affirm their value, highlight their role as peacemakers, because that's what phlegmatics are. I usually call them the Kofi Annans. They are diplomatic peacemakers and relational anchors in family and community. And so those are the people, when you are in a conversation, they will be the person who supports the underdog. You know, they kind of will come up with a logical way, a rationale for why somebody has acted the way they have acted. And so you want to affirm that even as they grow older, that is still a strength for them, and to be able to ask, what do you think? How do you think we can manage this? Mom, we know that for years you used to be the woman in the Nyakenyua group who would bring some peace when people are not disagreeing, and we now we have this thing that is going on. How do you think we can handle it? it's usually good to kind of remind them the value. Then provide routine with variety. Consistency helps, and phlegmatic individuals, they lack consistency, but occasional new experiences can prevent stagnation. So allow yourself also to encourage something new, something that they can learn. Then we have who we call the melancholics. This is the analytical individual, the person who is also a problem solver, but also kind of introverted, and doing a lot of mental work, and they may not, or they may express what they are feeling, but like the phlegmatic, they tend to really be introspective and to live in their mind. Now, the melancholic has a tendency towards sadness or depression, and the melancholic will be the person that we will say that they are moody, because when they feel their emotions, they wear them on their face. And usually it will be the sadness, the depression, the negative emotion that you will see. And so you can imagine a senior adult is experiencing a lot of loss in terms of health, in terms of friends, independence, and they may feel especially heavy within themselves. Then they have a fear of being a burden, so they worry about inconveniencing caregivers or family. Then they struggle with perfectionism, may become critical of themselves or others when things are not done right. It is good to understand the person that you are giving care to, or even yourself as you are heading towards that space of retirement and continuous loss of the things that we enjoy. Resistance to change. This is usually a melancholic trait. They have this thing of thinking in black and white, so they can be emotionally or psychologically inflexible. So strong attachment to routines can make transitions difficult. And so moving to assisted living, for instance, and like now with my mom, we've had to, she lived with me here in the city, and then I realized that socially she was becoming too isolated, and so I took her back to the village where she has her social networks, and therefore now the assisted living space for her is because she has a caregiver, because she has gotten to a place where she is unable to take physical care of herself. She's not strong, and so now moving to having somebody give her a bath, somebody who makes her food, and she cannot get up, go sit at the kitchen and create her own food. This is what we are calling assisted living. Now, when I lived in the US, there were assisted living communities. And when I was doing my master's, one of my jobs was that to take care of aging adults who live in these communities where they live together, and people come in to help them in terms of cleaning their house, in terms of helping them with just self-care, and taking them for errands, taking them for doctor's appointment and stuff like that. And so you can imagine now we would have the assisted living individuals who can do certain things for themselves, and then we would have the ones who are completely unable to do anything for themselves. It can be very, very stressful. The melancholic will have resistance, and even though they will allow you to help them eventually, it is usually a stressful back and forth with them, and learning how to manage that for them can be very helpful. Now, we want to validate their emotions, offer safe spaces for them to express sadness, grief, or anxieties. What you find with melancholic individuals, a lot of people think that they are negative because they tend to express more of the negative emotions than the happy emotions. And so learning how to balance that by validating mainly is not agreement. Validating somebody's emotion is what we call empathy, is being able to say, oh, I can see how you would feel that way. Is that thing that you normally say, oh, is that so? Wow, that sounds like whatever. You validate that what you're feeling and what you're thinking is valid because it's an emotion. And then encourage creative outlets. If you are a person who usually you will see that the melancholic, when they are younger, they write, they read, they like to do music, poetry, they may do art, because that they are very creative. Their brain is very creative, and so even in old age, we can really encourage healthy channels of processing feelings through art, through writing, through music, and things like that. And then promote social connections, because melancholic by nature, they are social beings. They're not social butterflies like the sanguine, but they are social beings. They love being with people. They love being in social spaces. However, they can't stay there for too long. They get overwhelmed, because one of the things about the melancholic is that they feel so deeply. So whatever auras are in that, if you want to call them auras, if you want to call them intuitions, they are there. They kind of are a magnet, and so they get exhausted, emotionally exhausted very quickly. And probably I'm speaking to one of us here. You always wonder why, after you have been with your friends for 1 hour, you want to shut down, you want to be alone, and your friends, they don't understand why. And probably it's because as a melancholic, you have a threshold for social connections, and then you need to pull away to regain your social energy. And so important to kind of understand that. Then gentle encouragement to stay engaged with supportive friends and groups. It's always good. Now, one of the things I have noticed in my work is that a lot of us, we keep friends not because they continually add value to us, but it's because of the sentimental value of having a friend who you met in high school. And so sometimes even our aging adults, we need to encourage them to kind of uh, keep the supportive friends and the groups, and make sure that we are not having them continually being taken away from them. Recently, I had a conversation with a family that was really concerned because their parent, the person they felt safe with, was actually taking advantage of them. But because they have known each other for so long, they are neighbors, and this is a sentimental friend, their parent could not see that this person is no longer adding value. They are actually taking value from them. And so it was quite a journey there to be able to figure out what the solution would be to help their parent who was on the verge of beginning to experience elder abuse. And so we want to kind of know that, remind them of their legacy, wisdom, and the value they continue to bring. Very important. Usually what I have noticed when the aging, somehow they start to talk about their past. And I have seen that happen with quite a number of aging parents, that you sit down, they start to tell you stories about their lives. And I, I know that as a mental health clinician, is that sometimes the brain needs to release, because it's safe now to be able to get out of survival mode and begin to release and to process what is in the memory brain. And that is where now we will learn a lot of wisdom from our aging parents or individuals. Now, the sanguine is the sunshine, and is the yellows. They love fun. They are the life of a party. And so these are their limitations. So may ignore or downplay health problems, leading to neglect. So they may not say what is going on because they don't want to create sadness. They don't want, oh, yeah, they don't want to be felt sorry for. And so you might find that they will downplay whatever their experience is to keep the positive optimism up. They struggle with boredom if routines feel too restrictive. And we know that individual who, even as children, they couldn't stay still. They needed to keep moving and to keep doing new things and to have too many things that are going on but never finish completely. And then they have forgetfulness and inconsistency, may miss appointments or fail to follow through with treatments. And before we reprimand them, before we say, mami apendangi kukunywa dawa, before we do all of that, we need to also understand that the sanguine individual, it has a challenge with forgetting, and they also have a challenge, of course, with inconsistency. Then superficial coping, yes, they use humor, they use distraction, talking too much, instead of addressing deeper fears about aging. So sometimes I have conversations with my mom, and she will talk about how scared she is because her friends are passing on, and now she is sick. And when I try to go deeper a little bit about her fear, she will dismiss it very quickly. And of course, now with our baby boomers, they are going to be saying, you know, my mother got into religion during the East African revival, and we know that those people are very strong in their faith. And so she will quickly mention, but God knows, God is in control. And many times I have to say, yes, God is in control, and God is using me to support you in this time. And so we kind of can get into a space where we can be able to support. Okay, make care fun and recreation for the sanguine seniors. Frame health routines as a group activity or social opportunities. Now, now there is, and I think in another slide I have this, where the sanguine seniors, they need what we call a seniors daycare. So they do need fun and recreational opportunities. The expression of creative expression is very good for them. Singing, storytelling, games, or arts to keep them energized. And then provide gentle accountability. So this sanguine senior, they don't do well if there is no activity that is exciting and creative. So what we want to do is really to provide that if we can, in whatever way that we can, and especially if they are able to mobilize other seniors and to create plans and adventures that we can encourage and help them to stay in that space where their energy is being used. Because if it is not used, it becomes mischievous. Even with our children who are sanguines, if you do not take care of that energy that child is feeling, you will keep saying, kaa chini, wacha kuruka, wacha kukimbia, kuja hapa, ni nini mbaya, you slap, you do what, but this energy is innate, and what we need to do is to redirect it somewhere, because then it becomes mischievous. Use reminders, check-ins, or buddy system for consistency, and that is where I'm talking about now, creating social opportunities for that sanguine aging parent to still have her friends and to have that buddy system where there is somebody who reminds them to do things. Because like I said, they can be quite forgetful. And then it is good for us to understand that even as our parents age, they still think of us, their adult children, as children, and they may not take us seriously. And when I work with family members and they are talking about their parents, they are not listening, they are not following through, I always say, do you know a friend? Do they have a friend they trust? Over the years, they have trusted, and then we can create bridges that way so that the caregiver, the child who is taking care of the mother or the father, doesn't have to deal with a lot of that frustration. And then honor their joy, allow space for their playfulness while balancing it with structure. So I hope this is helpful for us to kind of kind of look at our aging individuals according to the way that they are wired, then we can be able to meet their needs. Now, I wanted to share this. Filial anxiety is the worry that an adult child experiences regarding the anticipated decline and death of an aging parent, as well as concerns about their own ability to meet the parent's future caregiving needs. And I will tell you, because my mother's situation is pretty new. It happened this year when she started to go down and she's not able to regain her vitality. This is something that I have worried about. It is that even now, because by the time you find something that consistently will meet the needs that we keep seeing, it keeps us in that anxiety space. Now, factors that influence this kind of anxiety, number one, the bond between the adult child and the aging parent. So the fear of losing the bond, but also there is also the lack of the bond. And now I have to have compassion and kindness towards my parent, who probably, was not very kind growing up, has not been very kind to me while I have had my life. So the bond between the adult child and the aging parent can increase or decrease the anxiety, or it affects the anxiety in one way or the other. Then strong cultural expectations of the duty to provide for aging parents. So that is more mental, where now it is my parent is getting older. I feel a sense of being stuck because now it is my duty to care for them. And here is where we also talk about sibling rivalry, where there are some siblings, they don't want to be involved, while others are completely involved, and there isn't a balance of how the siblings are pulling together as a team to take care of their parent. Then demographics, female adult children are expected to, this is about the whole thing of because females are natural caregivers. Now, so it is expected that when the parents need that kind of support, the caregiving, then it is expected that the female child or the female children are the ones who are going to offer that, as opposed to expecting male adult children to do that. And so these are some of the ways that you will find now the anxiety, the apprehension, the worry of taking care of an aging parent may become a burden to either one of the children or several of them. And so conversations about that need to be very, very important. Then you have, these are supportive communities. There is a religious community, of course, social community. Again, this is where I normally talk about what's the benefit of a person leaving the city where they have lived for 40 years and moving to the rural area. We need to kind of look at that from a social community point of view. Is there supportive social community where they are moving to? I know a few of my friends who have spoken about how they have seen their parents, especially men, once they retire and they go to the village, then they decline. Now, for me, bringing my mother to Nairobi and taking her away from her social community was not necessarily good for the long term. And so for me, that social community need, I had to find it at her home and then provide the care that she needs. Entrepreneurship after retirement, this is very important. What will you do after you have retired? Having these conversations and supporting our aging parents to begin to think about that. For us who are in our 50s, 40s, 30s, and 20s, to begin to think about retirement and how we will do that retirement. There is retirement that is not prepared, that people have not prepared for it. Then medical care, consistency and normalizing the need for preventive medical care. Then champion medical checkup and treatment where there is a change, when there is a change of attitude or behavior. We want to make sure that there isn't issues of cognitive decline symptoms. I remember a friend of mine calling me and saying, can you come have a conversation with my mom because I'm not sure what is going on. And I went and I sat there and I listened to the lady, and she was all over the place. You could hear the confusion. And she wasn't an older lady. I think she was in her late 60s. She wasn't as what you would have expected. And I told her, it sounds like we are talking about, I am experiencing some Alzheimer's, dementia, kind of cognitive decline symptoms here. And so I encouraged her to go and see, to go and talk with a neurologist. And, you know, what happened is that when they went, they did the checkup, her mother had a UTI, which was causing, you know, the delirium. And so medical checkups, when we see that change of attitude or change of behavior, very important. Volunteerism after retirement is something that we can encourage so that there can be continued purposeful living, giving to the world, giving back. And being able to do that gives a lot of feeling of energy in terms of feeling that I am still purposeful. And then, of course, support groups for aging adults. Have mentioned elder day cares where they are able to go for trips, they are able to get together and have some social activities that help them. Now, so the stimulation, we all know stimulation and mental activities, puzzles, reading, emotional support is where we are talking about active listening and empathy. Give space. Now, when I have noticed so a few elderly women that I have had to sit down with, one of them being my late mother-in-law. When we would sit, she was in her late 80s. And every time I went, she would tell me stories of how young she was when she got married. And so she would tell stories about being 16 and what happened, how she got married, and then the journey of becoming a mother, becoming a wife, and then the Mau thing, you know, going to in Kikuyu, they call them Begeshagis, you know, you are taken to these communal spaces where you lived in. I think they were like camps, and their husbands going to war, and she would tell these stories. And I realized that she needed that storytelling space, and I would just listen actively and ask more questions. Now, validation is recognizing life experiences and how they have contributed to life. Then we want to also look and see now counseling and therapy for the older generation will look very different from counseling and therapy for individuals who are Gen Xers and individuals who are millennials. And so being able to understand what that looks like is very important. Then practical help like assisted living. My mother, she refused to have a walking stick for a few months, but eventually she was willing to see the benefit. And once she started to use it, she actually saw it gave her autonomy. Now she doesn't have to wait for somebody to come help her up and then watch her or hold her so that when she walks she doesn't fall. And it was good once eventually she accepted it. And then encouraging regular visits, calls, and intergenerational bonding, very important. I used to do that with my mother-in-law, with my boys. We would make sure that we consistently go to visit her, spend a day with her. Community connections, day centers, clubs, religious groups, and volunteering. Peer groups, I have said about that. Spiritual practices, very important. And then this sharing of memories. I have spoken with my mom several times where I'm telling her, tell me the stories, tell me those stories of what happened, how did things go? My parents are were broken up. I mean, our family broke up when I was in my early 20s. And so I have had moments where I'm asking my mother, tell me what happened. How did you meet Dad? How did you guys progress? What actually happened? And then we have those moments where she is sharing her wisdom, she's sharing her experience, and it causes us to connect, and we want to do that. Helping elders feel a sense of purpose despite physical decline. What is it that we can do? Where can we plug them into the community? There are a lot of people who are in their older generation, but they have a sharp mind. They still have a lot of wisdom, but they cannot walk. They can't go like they used to. But we can bring them to social spaces for them to share wisdom, for them to teach children, for them to teach the young people, to tell them stories about their own struggles. It gives them a lot of that vitality. Now, because I know my time is really gone, I'm going to go now to the caregiver. And like I have said here, we all burn out differently. So know your style. And this is, again, the temperament refers to your individual inherent biological-based behavioral style and emotional reactivity, recognizable early in life, and then often considered the foundation component of your personality. And this is now, again, the temperaments I talked about earlier. And so it is important for us to look at this. So the choleric caregiver, this is what is going to be that you are driven, task-focused, and leader type. Your strength is organization, decision, goal-directed, taking charge. Signs of your burnout as a choleric caregiver is going to be increased irritability, impatience with caregiving, responsibility, and even the recipients of your caregiving, plus others who are in the same environment with you. Harsh self-talk, where I'm saying I must do it all, no one else can handle this. So that need for control. Then frustration when progress in caregiving is slow, controlling behaviors intensify, and difficulty delegating. So what the risk is for the choleric is anger, resentment, buildup, possible relational conflicts. And then the self-care tools here is to learn how to find accountability. You might find somebody and you say, hey, you are my dear friend. When you see me going beyond, please pull me back. Talk to me, I give you permission. And then learn to delegate, learn to trust that other people can be able to do the thing you do. They may not do it your way, but they can do it. And then rest. Think of rest as a strategic recharge. It is not a waste of time. It is a strategic recharge so that you can reduce the irritability, you can reduce the stress buildup, and then have a balanced need for control and trust on the ability of others. So that is what I'm talking about, where you can delegate because your need for control and the trust you have for other people being able to do it can bring about some feeling of rest, feeling of release. And then make sure that your spiritual help is part of your walk in your caregiving space by learning how to surrender to a higher power. Again, that is being able to trust other people outside of yourself. Then the melancholic caregiver, the thoughtful, detail-oriented perfectionist. They are thorough, they are committed, they are attentive to detail and compassionate. Their burnout sign will be overwhelmed from perfectionism. They feel like they are never doing enough. The heightened sadness and depression or guilt when things don't go the way they are supposed to go. People who say that I am very hard on myself. You want to learn how to reduce that. Withdrawal and isolation, no one understands what I'm going through. And then physical symptoms from suppressed stress will be headaches and insomnia. So the risk is deep emotional exhaustion, increased vulnerability to depression, and now the feelings of hopelessness, which can lead now to suicidal ideation or attempts. Now, some of the tools here is boundaries, having boundaries to avoid overfunctioning or becoming a martyr. Or like we say, that you feel like you're the savior of everybody. And so the difference between the melancholic and the choleric is that the choleric is driven by the task, and the melancholic is going to be driven not only by the task, but also the relationship. They are going to be feeling all these emotions that the other person is feeling, and that is the emotional exhaustion. And you want to make sure that you're taking care of yourself by creating boundaries on yourself to know when you need to take a break, when you need also to delegate. And then safe spaces for the melancholic to vent. The melancholic caregiver needs a place to express how they are feeling, because if they don't, they overthink. You see, the choleric vents whether anybody is going to listen or not, but the melancholic is too caring about how other people will experience them. Therefore, their empathy levels are very high, and if they don't have a safe place to vent, then depression and that emotional overload is going to be part of how they struggle. Then creative expression of emotions, because usually the melancholic is quite creative. So writing poems, singing, creating music, and other things that are creative can really help them. Painting, drawing, as well as coloring can really help, because it is a space where they can express things. Then practice gratitude, very important. The melancholic can be quite pessimistic, so they see the glass as half full, half empty. So they tend to focus more on the negative. And so practicing gratitude becomes important. Celebrating small wins helps with the perfectionism, so that now we are looking at the process, not necessarily the progress, not necessarily perfection, that things have to be perfect, but we are moving, and that's what we want to look at. And so usually with spirituality, the book of Jeremiah and Lamentations can be very helpful for the melancholic to express all these negative emotions without being judged, and just to feel those emotions which are negative. And it helps, because then in the process of that, whoever is listening can be able to bring them back from this perfection space where they want things to be perfect, and offer grace and compassion to them by validating how they feel, in order for them to be able to move towards the positive space, the space where it's more healthy than when they are just looking at the negative. And then we have the phlegmatic caregiver. They are calm, they are patient, and they are peacemakers. They are gentle, they are dependable, steady, and non-confrontational. Signs of burnout: avoidance of difficult tasks or conversations where they tell themselves, I'll deal with it later. So let me give you an example that is very, very common with married couples. So one of them says, and we needed to do such and such. What are you thinking about it? And they say, oh, don't worry about it, I'll handle it. But then 2 months, 3 months, it's still not being handled. That's your phlegmatic. They tend to avoid difficult tasks and conversation by saying, I'm doing it, I'm going to fix it. Emotional numbness or detachment from the care recipient. So the phlegmatic by nature, they can learn how to block. They can create walls, they can compartmentalize, and there isn't much emotional connection with the person that they are taking care of. Then they can have passive resignation, going through motions without energy. They just do it. Myself, I'm a phlegmatic melancholic. And so I know, even when I'm exhausted with my children, I'm just going through the motions, because I am feeling that passive resignation. As long as we tick the box and tick the box. And there are times when it is different. So the self-care becomes very, very important. Increased procrastination. Now, I need to say this. When I was doing my master's program, I had to deal with procrastination because it was very bad. So I wrote a paper on procrastination, and I learned a lot on how to manage, because procrastination was not really the problem, it was the outcome of something else. And so I really really worked on that. And one of the other things we know about phlegmatics is that they want things to stay the same. They don't like change. It's almost like phlegmatics are just lazy when it comes to moving with what is happening, moving with waves. They are not really good at that. They want things to stay the same, and they will find they have no energy. And so procrastination becomes the outcome of this low energy. Silent suffering is their risk, and unnoticed burnout, because they rarely explode. They don't show much emotion. So self-care tools would include encouragement to speak up, confidence building through celebrating their efforts, reminding them of their value, what they are doing, and then for them to learn how to take walks, how to have me time and not feel guilty about it, how to have prayer and meditation as ways of being able to recharge and to get in touch with themselves. Now, the sanguine caregiver is cheerful, social, energetic. They bring joy, optimism, and creativity into caregiving. I had one of my cousins. We lived in the US together, and we would do caregiving work, and she was excellent with this energy, and she would be cheerful, social, energetic, and very optimistic, while me, I would really struggle with all this need for energy so that she can be able to do her caregiving work as excellent as she wanted. So what happens is that the signs when you begin to see a sanguine show loss of enthusiasm and difficulty staying positive, you know they are in burnout. Escaping into distraction, social media, entertainment, constant talking instead of resting. And then there is also the issue of addictions, like now drinking or socializing, going from club to club or whatever, just having this frenzy of activity. That's a sign of burnout. For the sanguine. Also irritability when they feel unappreciated, and we know that they work and then finally they start to say nobody cares about what I do, nobody appreciates what I'm doing, and crying. So they may not be the choleric who is angry. They are going to be the sanguine who is crying, who is emotional, and really needing that validation and comfort. Then difficulty focusing and following through on responsibility. As a sanguine caregiver, you will need a lot of help with creating to-do lists, with writing dates, and making sure that the tasks of caregiving are written somewhere. Because remember, I said the sanguine tends to be forgetful and inconsistent. But that tool of discipline, making sure that there is a discipline to remember, is very important. Balancing fun with discipline then becomes now how can you create the discipline but still enjoy the fun as you want, because again, that's the way you are wired. Fun activities to express emotions, social activities, and accountability. And this is where the sanguine caregiver would need to be encouraged to get into their weekly space where they do their Zumba, where they do their hiking, where they do their laughter, and that kind of thing. It's good for them to do that. So when we think about now preventing and managing caregiver burnout, in addition to the things I have said, therapy becomes important. Now, emotional intelligence and social intelligence is very important. They are skill sets that we must develop so that we are self-aware. That's why I put this in terms of who are you, how are you wired, so that you are aware of yourself. You have these self-regulation skills. Once you are aware of yourself, as I have shared, then you can be able to know that because I'm a choleric, these are the self-regulation skills I need: anger management, irritability, managing my stress better, If I am melancholic, this is what I need to learn how not to live in my head and to express what I'm feeling. And if I'm a phlegmatic, I don't need to freeze. I need to be able to communicate what's going on. So communication, social awareness and social competencies to increase healthy relationships. And this is where now we are talking about skills like communication and conflict management, how to express what is going on inside to decrease cycles of maladaptive expressions of stress and distress. Then if you are consistently experiencing intense frustration, anger, and rageful thoughts towards your aging parent or even an aging person that you are taking care of, please do some inner child therapy, especially with parents, to kind of look at attachment therapy, to explore, process, and resolve childhood woundedness perpetrated by the parent you are taking care of. It is important to do that. It's self-awareness, and it helps to reduce the amount of reactivity, emotional reactivity that you are wondering where it's coming from. Therapy can also assist with negative reactions from our natural temperaments, that is, increase emotional intelligence. I also want to say that there are people who, because of childhood trauma, they overcompensate the care they were not given. They overcompensate by giving to their parents who are aging. And you find that now there will be a blow up somewhere. And the parent will hear what the child will say, or the parent will say something that is pretty damaging to the child, or the child to the parent. And so it's important. That's why it's important, if you feel this consistency of intense frustration, emotional reaction, it is best that you seek therapy to be able to be okay. Because then if the parent departs from this world, then you are left with a lot of unresolved issues in your mind. Therapy can also help with social intelligence, accountability. This is so important. How many of us growing up, we have children, or even we have friends, we have colleagues, we have bosses, we have people who cannot take accountability for their part in the problem. They are always blaming somebody else. Therapy can help with us becoming self-aware, so we know the spaces where we need to develop healthy accountability, assertiveness, being able to say, this is how I feel when you do X, Y, Z, but to be able to say it and say, and I tell myself, you know, to be able to say it in a way that is respectful, compassionate, and empathetic. Then we have transparency and truth-telling with compassion. And this is important. Why transparency is important is because transparency in communication, in relationships, triggers what we call trust. And when trust is there, then there is safety. Love does not provide safety. Love provides that bonding. But trust is what provides safety. And it is very important for us to explore that. So assertiveness in mental health is the skill of clearly, confidently, and respectfully expressing my needs, my feelings, my boundaries, while I respect another person's rights and views. So I might use something we call the I statement, and I might phrase, I feel, and I say my emotion when your behavior, and I start to tell myself that you are doing, because that is the intention that I am reading from the behavior. And then I say, I would like you to. So I'm setting a boundary. So instead, we normally accuse, defend, blame, criticize, put down, and refuse to talk, which is counterproductive. So those are skills that we can all get. Now, conflict management. This is I borrowed this from the internet, and there is avoiding and competing. These two are the ones we normally say they do not work. So the choleric will be the competitive person. One party seeks to satisfy interests regardless of the impact of the other party. Avoiding, this is the phlegmatic. One or both parties seek to suppress the conflict. Now, this accommodating here is where we want to start, but hopefully the two people or the two parties, they are willing to accommodate each other. So one party yields the win to the other party. Hopefully we are doing it together, so that now it's not one person. Now, when we come to accommodating, we start on the journey of healthy conflict management. So we go to compromise, both of us win and give up something. And then eventually we get to collaboration. And this is where both parties win. Now, this skill set, you're not going to get it just like that. You have to go through some training in emotional intelligence and social intelligence so that you can be able to work on those skills. These are not skills we are born with. These are skills we develop over time. So taking care of your spiritual soul, self and soul care, this is very important because your soul is your inner experience. And that inner experience needs to be taken care of. So practicing the inner life, making sure that you are nourishing your inner life, creating a sense of meaning and connection. So community and fellowship, not always religious, but fellowship is where you have people who are of common mindset and common goals that you get together, create a community for you to commune with each other so that you can get connection and you can have a sense of meaning. Then for those who are believers, scripture, then you can have affirmations or mantra focus. Anchoring yourself in daily gratitude, so important. So what is it that I can be thankful for in the midst of all that is going on? Grounding practices where you are taking a moment to enjoy nature, feel nature, like walk on the ground, walk on like when we go to the beach, or even I have a small garden out here, going there barefoot just to feel the feel of walking on that natural soil. And watching nature, where I'm watching the sunrise, or I'm watching how the wind is playing with, the leaves and all that, or whatever it is that I am watching. Smelling nature, listening to nature, and touching nature. All these are grounding practices that can bring our body into the present moment and release stress. Release and surrender, the difference between what you can control and what you can't. And there is a prayer that is called the serenity prayer. God grant me the serenity to accept the things that I cannot change, and the courage to change the things I can, and to know the difference, wisdom to know the difference. And so each one of the temperaments would need to understand how this prayer can support their stress-free life, or their well-being, their soul care. And then perceive rest as sacred. Take time away to rest. What is your sleep hygiene? Now I will tell you that usually I will find myself scrolling mindlessly on social media and just before I sleep. And that causes now my ability to fall asleep and fall asleep properly is being impacted because I am stimulating my mind instead of allowing my mind to calm down. And so your sleep routine becomes very important. I will tell you one thing that I usually don't have in my bedroom. I have never had it, except the day I used to live in a bedsitter, is a TV. There is no TV in my bedroom. There has never been when I have a bedroom, except when I lived in a one-roomed space. Because I know that if I do that, then I'm going to be pulled into watching a movie when I should be resting. Then use spiritual practice to silence negative thinking, which triggers guilt and shame, comparisons, and feelings of victimization. So what is that spiritual practice that you can use that is higher than what you are experiencing from other people, what you are hearing from other people, so that you can allow yourself to grow, can allow yourself to stay in that space where there is less stressful living. So I hope that has given you quite a bit of things that you can be thinking of, and I hope it was helpful. And again, thank you so much for allowing me to be here today.
Thank you very much, Dr. Grace. That has been a very insightful session. I think this topic could not be covered adequately in a single session because I feel there's a lot that really would have gone into this. Yeah, but thank you for even trying to compress it into that power-packed session. Yeah, so I think the general message here is that we need to first understand the personalities for at least the aging people and ourselves as the carers or any other carer as we seek to give the best and make the best out of this aging experience and even the experience, the care that we give. Yeah, so I think with that, I'll really ask us to just appreciate our presenter with some emojis, clap emojis. I think there are usually some, let me see if anyone is getting it. There's usually a way you can clap if you can do it either with the in the chat box or anywhere where that usually works. Yeah. Fine. And in the meantime, as we are doing that, I will want to just direct to you a few questions and one inquiry. So maybe in a minute or two, mention a thing about how we should approach grief and in old age, maybe and especially for spousal loss. And then the other thing was what would be your view on institutionalization or family-based care for these people?
Now, I would say in grief with the older generation, the process is the same. What we want to do is to identify their loss. What is it they have lost? So when a person loses a spouse, we need to ask, what is it that they have lost so that we can allow them to vent or to talk about the loss. So they are losing companionship. And some people, they lose the leader, the person who did the leadership in the home. So this person who has been left, they have no idea what to do. And they don't know how to, the other person was making a lot of decisions and stuff like that. So you want to identify what is the loss. And this is where it's very important, if you don't know how to do it, to be able to join support groups for loss for older adults, or to really talk to a therapist, a family therapist, to help you as a family know how to support. Just recently, this week, I had a gentleman call me about their mom who lost her spouse a few years ago, and now she is reacting. And the way she is reacting, it looks like spiritual oppression, or it might look like mental illness and all that. And I said, really, she needs to be given some 4 to 6 sessions of grief therapy so that she processes the loss of her spouse. And that is what we want to do. As families, we need to understand there is a difference between mental illness and there is issues that have to do with the loss and grief. And in the loss and grief, there is depression, there is anxiety, there is nightmares, there will be even sometimes psychosis, but that is not these are symptoms, but really the root issue is probably the loss of things which were very important to them, and they are finding it difficult to shift. So for people to shift their thinking, as usually they need somebody to listen, somebody to be empathetic and hold space for them so that they can be able to process it out, and then now their brain can begin to create solutions. So that's what I would say. What was the other one?
Oh, your view on institutionalized care versus family-based.
Right. So I usually say this. We need to understand that if we take our older generation to an institution, our cultural view of that is usually we have abandoned. You see, so there is a need to shift that because there are too many of our parents who are staying at home, but we are so busy in Nairobi. taking care of business and sending money and paying somebody to take care of them, only for us to go home and find out that there has been a lot of what we call now elder abuse or neglect, because the person that we engage to take care of them have no idea how they don't even have the skill set. They don't have the clinical understanding of whatever the health of our loved one is. So sometimes I usually say we must begin by changing our perception. That is number one. Then number two, we need to understand that if there is an institution of care, there are doctors there, there are nurses there, there are psychosocial support people there, there are behavioral therapists, physiological therapists, all that, and even mental health therapists. We have that kind of consortium of care. And so that in itself is going to offer what your parent needs. But we need to understand we can't go and dump them there and then we are gone. So we need to create a way that our loved one who is getting the best care is also getting social care. But there is also the fact that in institutions like that, now the daycares I was talking about, they are available there. The activities for the older people to sit together and commune with each other, it's there. So it is I think most of it is our perception of what institutionalized care means. So if there is a place where it's safe and you have done your due diligence and you keep going to hold people accountable, but also to see your loved one, why not? It's better than having ule mama wa hapo hivo who has no idea about anything except ako kwa nyumba, you see. So we do need to really allow ourselves to ask, what is the need of my parent? And therefore, where do I get that need met?
Wow.
Yeah.
Thank you. Thank you very much. I think that's a very nice place to end. So once again, thank you very much for sharing these insights. I think we'll look for you again for this. Yeah, so I'll ask you to just project the segment with your contact details and how people can reach you. While in the meantime, I'll ask Dr. Diana Marion, our SG, to just take over and wrap up the remaining part of this session. Thank you very much.
You're all welcome.
Good evening, everyone. I want to really appreciate everyone. I'm held up in a location that I might not say much, but I want to appreciate the speaker. I want to appreciate the moderator, and I want to hand this over to Dr. Aida Wanjiko to close. Thank you.
All right, thank you very much, our Secretary General, Dr. Diana Marion, always for the support from the National Executive Council. Thank you as well to our co-laborer in this Senior Doctors Network, Professor Okeo, and to our gracious speaker, Dr. Grace Kariuki Nderito. We are very, very happy to have learned from you. And I know that this will be uploaded in the YouTube in the coming days. So you feel free to search Kenya Medical Association and the YouTube channel, and you'll be able to have a revisit of this very educational webinar that we've had. Otherwise, Dr. Rono, thank you very much for steering the ship. We appreciate your moderation. And for everybody else, thank you so much for joining, and do have a blessed night. Continue to discover who you are, be aware of your personality so that you can be the best in caregiving, even as we take care of ourselves and the ones who are aging around us. From Physician Wellbeing Committee, it's a big thank you, and have a good night. Bye-bye.
Bye-bye, everyone.
Bye.
Bye-bye all.